you can introduce Carol and Marcia, okay? All right, I'm going to go ahead and get started.
Okay.
Thank you. Well, good morning or good afternoon, everyone, depending on where you are. This is Joy Burkhardt with 2020 Mom, and we're thrilled to be presenting an additional Innovation Award-winning program today from the Nan Tolbert Nurturing Center. It's their Emotional Care Home Visiting Program. With us today are 3 members of the Nan Tolbert team. You'll get to meet them in just a moment, but before we introduce them, I'd like to quickly thank the Zoma Foundation again for making this program, the Innovation Awards program in maternal mental health, available and possible. Winners receive funding and also a trip to present their program this year in 2019 at the Marseille of North America conference in October, and last year at the Postpartum Support International conference. So we just, again, want to thank Zoma, the Zoma Foundation, for making this program possible. And before we introduce our 3 presenters today, we'd like to start off by asking who's on the line. And so what we're going to do is ask that each of you use your GoToWebinar control panel question feature. The control panel is the long, skinny box, usually on the right-hand side of your screen. If you can't see it, just toggle. It's probably behind something. And go ahead and open up that question box, and you can let us know who you are. You can share your name, the city you're with, and why you're interested in today's program. So we're going to give folks just a minute to use that question feature and let us know you're on the line. There's about 12 of you on so far, and we expect quite a few others to be listening to the recording post the live session today. So if you wouldn't mind, those of you on, I see Ida and Liz and Lindsay. If you want to let us know where you're from, Adriana, Teresa, please go ahead and use that question feature and let us know where you're from and what interests you about this program. Great. So a couple of folks are letting us know where they're from. Hi, Melissa in Richmond, Virginia. Glad you're with us. She's a clinical social worker and an early childhood home visiting program, in an early childhood visiting program, and you provide mental health support to moms. Well, that's great, Melissa. Welcome, and we'll be interested in hearing what you have to say today. And Lindsay Dunbar is a health educator at the Pueblo Department of Public Health in Colorado. Hi, Lindsay. Glad you're with us. And she works in mental health and suicide prevention in this population, working with depression and anxiety. So, Lindsay, we're glad you're with us. Let's see if anyone else has shared. Oh, hi, Christine Morton. I'm glad you're with us. Christine's a researcher, a sociologist out of Stanford here in California. Glad you're with us. Melinda Klein is with us. She's a perinatal psychotherapist at a community medical center in an outpatient maternal fetal medicine clinic. Great, glad you're with us. Let's just introduce a couple other folks before we get started with today's program. Liz is a practicum student out of Missoula, Montana, and working in an OBGYN clinic. Great. Thank you, Liz. And a few others on the line as well. So glad we have someone from Rochester, Michigan. Thanks, Teresa. Great. Well, a good group of people on the line. It's always nice to know who we're with. Don't be shy. We're going to be taking questions throughout today's session, and we'll stop at nice points to be able to ask our team members who are presenting today some of your questions as well. So let me go ahead and introduce our 3 speakers today. And I'm actually going to start by introducing Renee, who I had the good pleasure to meet. Hi, Renee, at the Postpartum Support International Conference last year when she presented her program. And I love that Renee and Carol and Marcia are all just really down the street from where I am. So it feels good to know you're in my backyard, Renee. Renee's the ParentCare Program Director, so the program that we'll hear about today, Renee oversees. She has an MA and is the director of the Nan Tolbert Nurturing Center Secure Beginnings ParentCare Newborn Home Visiting Program, which she helped develop in 2012. We'll get to hear more about that in just a moment. She's been a facilitator of a breastfeeding helpline and breastfeeding support groups and prenatal classes and infant and caregiver groups. She co-founded a perinatal wellness group to support parents through emotional transitions of welcoming new babies into the family. She's attended and presented at many conferences. She also became a certified birth doula, which I know you'll appreciate, Christine and others on the line, and has been working with expectant and new families since 1998. She also has been working in private practice again as a certified postpartum doula, also a lactation consultant and counselor and educator, as we've heard earlier, and through her former business called the Mothers Guild, where she provided lactation education and support in various settings throughout Ventura, Santa Barbara, and Santa Barbara counties. Well, with that, Renee, welcome. Congratulations again. It's great to hear your voice, and we would love to have you introduce Carol and Marcia as well.
Hi, Joy. Thank you. I'm here with Dr. Marcia McEwen, who is our clinical director at the Nan Tolbert Nurturing Center, and Carol Castanon, who has been our executive director for about 10 years and has recently stepped down but remains involved with the center as a parent consultant and just overall guide for our organization. Both of these women did help to launch the ParentCare Newborn Home Visit Program back in 2012 with me.
Great. Well, welcome, ladies, and it just sounds like you have a really incredible team, and we're thrilled that all three of you are with us today. I'm going to go ahead and kick us off by asking you to tell us just a little bit about Nan Tolbert and the center and why the nonprofit was founded.
Hi, this is Carol Castanon, and I'm going to do my best to give you kind of a landscape of how we started. Nan Tolbert was a nurse and a lactation consultant in the Ojai Valley and started the Ojai Valley Birth Resource and Family Support Center in 2001. She passed away in 2006, and in 2007, some of her friends and colleagues started the Nan Tolbert Nurturing Center. And that was really based on the work of Nan knowing that that families needed support after the birth of a new baby, and that no family should be alone. And the programs that we initially began with were funded by our local First Five program, which is a tobacco tax in California that funds early childhood programs. And we had a contract with First Five that was really about parent and child programs, but it didn't necessarily describe what we should be doing with parents and children. And so over the course of the first couple of years of the nonprofit, we began to define what is it that families might need and what was our capacity in providing those services.
Great. That's a really helpful overview. And you told us a little bit about where you're located. Is there anything else that you want to share relative to the counties that you serve?
Well, that now that you brought that up, I was thinking when you said that our space is infant toddler specific. And that means that instead of expecting babies to accommodate an adult space, we're actually asking adults to accommodate an infant toddler space. And why that is useful is so that parents can actually calm and know that their babies are safe. We found that setting is actually really essential to parent and child work together. We do sometimes see parents, though, in offices that are specific to adult psychotherapy. And, of course, we have our home visitation program as well. Our center is in Oakview, but we have psychotherapy support in both Ventura and Ojai, and then our home visitation program can go throughout Ventura County, sometimes Los Angeles. And by the way, some of the support that I've offered just in terms of parent consultations have been long distance and by the telephone. So we are expanding our capacity to work with families long distance.
Okay, that's helpful. So let's talk just a little bit about, we know that the program that received the award, and really it was honoring all of your work, but it was the home visiting program. But before we get into the unique aspects of your home visiting program, you sort of touched on the fact that you provide some sort of services to parents, even if the space is for babies and toddlers. And what I know from your program is that you are providing psychotherapy services. Can you talk just a little bit about what that looks like? We see on the slide up on our screen right now that you serve families on a sliding scale basis. Can you tell us a little bit about the psychotherapy program that you provide?
Yes, hi. This is Dr. Marcia McEwen. I'm a clinical psychologist, and I am the clinical director at Nan Tolbert. So one of the things that you all are familiar with is that families at this point in their life, often, not always, but often, are beginning sort of the foundation of their financial health, their financial foundation of their families, beginning in careers as they begin their families. And so low-cost psychotherapy and low-cost support in any way is really important. As we began to identify the emotional needs of families, of moms, of babies, how to support that relationship, dads, siblings, we brainstormed ways in which we could provide low-fee psychotherapy. No one is turned away for lack of funding. And the way we do that is that Nan Tolbert is a training site for PhD and master's level psychotherapy interns. So these are graduate students in psychology programs training to be psychotherapists. And what we provide is training for those students, close supervision of those students, and they then are able to provide low-fee psychotherapy to anyone in our area who has a child below the age of 5 years old. They don't have to be associated with the center at all. So that's kind of how we do that. And so there's two aspects of the clinical program at Nan Tolbert, and that is as a training site, and we're a very unique training site because we have parent-child groups happening all the time. So interns are able to observe weekly parent-child early attachment. And that is part of the long-term training of psychotherapy students. And then the second part of that, of course, is providing services. And that could look like support for a mom with postpartum depression. It could look like psychotherapy support or couple support for marriages that are struggling. It could be support for families who've gone through some sort of trauma or a child who is ill. It could be doing family therapy. And one of the most exciting things we do is doing attachment work with parents and children together who are having a tough time finding each other. And so we work together with those moms and babies or dads and babies to support that attachment.
Great. Okay, thank you. We have a slide up on the screen, now, that talks a little bit about that early attachment and first relationships, and it's just such a great overview of what it is that you do and why you do it. And I love the sentence here that says, healthy development of the parent, child, and family. So to acknowledge that it's not just the child that's developing, it really is the parent and family. And then why you do it, right? It leads to all of these important things: improved social and academic and emotional lives for not just children, but families, communities in our world. So just so beautifully said. Thank you for that. We're going
and actually, if I might just underscore that a little bit, that
absolutely
one of the very foundational beliefs and kind of guiding principles of Nan Tolbert is there is no such thing as a baby, for example. That's what Winnicott would say. There's no such thing as a baby by themselves. There's no such thing as a mother by herself or a father by themselves. That our intention of support and our focus is always on relationship and what is building between members of family.
Very good. That's great. We appreciate that. Well, I wanted to ask you if you could touch on a little bit about your demographics in your community.
Yes, this is Carol. So we are socioeconomically diverse in the Nan Tolbert Nurturing Center and in the Ojai Valley, certainly in Ventura counties. What we find at the center is that we have families who have the capacity really to get help or services or play groups anywhere that they would choose. And then there's a percentage of families who actually don't have a lot of choice. In fact, they might have no other choices as well. So we are determined to turn no family away. Typically, about 50% of our families are either low income or too extremely low income. The ethnic diversity in Ojai is predominantly Caucasian. And having said that, we're very aware of the different cultures who come into our center and are wanting to be not just thoughtful, but curious about how we might meet the cultural lens that families bring to the center. One of the grants that we just got was for Abriendo Puertas, which is Opening Doors. It's a program for Spanish-speaking families 0 to 5. We've been working very hard to create bilingual or Spanish-speaking programs for our Latino community. And we hope to be able to expand our parent care services to Spanish-speaking families. Is that what you were looking for, or should I be answering something else?
No, that's helpful, and we do see up on the screen your demographic overview of your community in Ventura County. So thank you for sharing that. No, it's helpful to also learn how you're serving the Spanish-speaking population. Great. Well, let's move on again. Wanted to really have you introduce to us the programs that you provide. And up on the screen now is the slide that says what you started to share earlier, that the baby is really in the middle and the caregiver is in the middle, and then all of these services that you provide. And we'll really spend some time after you do an introduction on learning more about your home visiting program.
Hi, Joy. This is Renee. So we have always felt that home visitation is vital to be part of well-being for families at the very start of life. And in 2012, we kind of, started to find our way with this home visitation program. This is a 3-month program where a trained and background checked volunteer, carefully screened volunteer, is matched with a family. And they go visit for 3 months in a capacity that is not clinical and not teaching, but I call it hands and heart. And our motto in the ParentCare program is the more parents feel cared for, the more they can care for their babies.
That's great. Thank you. And then do you want to introduce, we see the newborn home visits here on the top of the box. You talked a little bit about, I suppose we talked about low-cost counseling. We haven't really talked about parenting consultations and the play groups. Do you want to walk us through all these other services, and then we'll come back around and go a little bit deeper into the home visiting program?
Sure, I'd be happy to do that. Sometimes parents are needing, they're feeling, actually, let me ask Carol to reference parenting consultations.
Hi, this is Carol. I just wanted to sort of go back to the idea that the programs are really about family engagement. To emphasize what Dr. McEwen was saying was that our programs aren't just about the adult, they're not just about the child, they're about the family. And so all of the different services that you see that wrap around the baby and caregiver are really about family systems. Parenting consultations are non-clinical. They are a way for parents to get a sense of what is developmentally typical for a certain stage of development for the child, certain stage of development for the family. We talk about not just the birth of the baby, but the birth of the parent. And so we're very sensitive to the transitions into family during 0 to 5. Parent consultations are sometimes as sort of ordinary as developmental information, and they're sometimes as extraordinary as helping families walk through illness or grief or loss or other transitions that can be difficult. Often families reach out for a parent consultation because there's something difficult that's being tried that parents are trying to understand. So that's what a parenting consultation is. Do you want me to wrap around all of the different services that you see here?
I think so. I think people will really appreciate hearing that. And give us an example before you move on to the others of the parenting consultation. So would this be something, I know we know Renee especially is providing breastfeeding consultations, but maybe like sleep, if a parent was having difficulty with sleep, would that be an example of a consultation that they could come in for?
Yeah, sometimes parents come in because they have questions around sleep, or eating, or pottying, or crying. Those are issues that sometimes come up. Sometimes it's about a parent just noticing what a child is trying to work through, so parents don't get just stuck in the behavior. They begin to have a sense of what a child is facing and what a child is thinking about. And of course, this is nonverbal. The first couple of years are all nonverbal, and so it's this, it's a right brain to right brain knowing that Dr. McEwen can talk more about. So it's understanding the other through behavior and tone and prosody and tears and smiles and eye contact. So if I go around that circle, we have play groups because we also know that play is a child's nature, that play is not an option, and we want children to have the capacity to have play that is uninterrupted by grown-ups, but can be nurtured by grown-ups. So it's our play groups are play-centered. We ask adults actually to observe play, to settle, to calm, and to notice what their child is doing as opposed to wanting their child to do something more. Our Spanish language programs have been developing and changing and shifting for the last decade. We're really excited about our new program of Abriendo Puertas. Jessica Mendiola is our Spanish language coordinator. And that was the commitment that the sort of the business of the nonprofit made, that we were going to keep trying to get it right for our families in our valley, and in some ways we do that with all our programs, right? We keep discovering, like, oh, this is what this family needs, or this is what this family is looking for, and then assessing whether our organization can provide it or whether we need to refer outside of our organization to others. The special needs programming, that had an interesting beginning because our first PhD intern had two children who had special needs. And she was wanting to create a support group for other parents whose children had special needs. And she also wanted to provide psychotherapy. And this is actually how Dr. McEwen came on board, was she came on board as a supervisor for that PhD student. And we created groups for families whose children had special needs, where children could come to the center and play and be supported while adults had the conversation of sometimes hospitalization, sometimes doctors, sometimes grief, sometimes just connecting with others who have a similar life experience. And it was quite powerful. And now we actually partner with Tri-Counties for parent education and parent consultations. And of course, we can provide psychotherapy as well if that's something a parent wants. The parent and professional training, I can let both Renee and Dr. McEwen talk more about that, but we've been developing, it's certainly for psychotherapy and for parent care, but along the way we've been developing training for our facilitators in the play groups, because what we do is so unique in that we ask the parents to observe, that we offer parent education, that we're not just about play, we're not just about the child, and we're not just about the parent, but we're about that relationship. Community referrals and resources are fluid, those are always growing and changing, but on our website we have different articles that people in our community or in our organization have written to be a resource for families. And again, if we have families who are looking for something that we can't provide, for example, rental assistance, we can then refer out into the community. The free diaper bank was started by Tammy Winberry, who has been the director of Nan Tolbert Nurturing Center for the last year and a half, and that has been really profound in supporting families with actual concrete support for what they need for their babies. And it's also an entry point sometimes for families to know about the other services or programs that we offer. The Young Parent Program actually started because we had a young parent come to a play group wondering if she would be the youngest parent in the program. And I said, you probably will be the youngest parent, and there will be someone who will be the oldest parent. And as our relationship with her developed, she then became our young parent coordinator. And we've been developing that program. And that program, it's a tricky program because it's hard to, it's actually sometimes very hard to get young parents together. But when we do, it's really quite profound for them to be in the company of their peers. And so we've been offering a once a month dinner, play group, sort of social time for young parents and their children. Then we have our low-cost counseling and our newborn home visits. And again, no family is turned away for lack of ability to pay. So that's our wraparound care.
Great. Well, we appreciate you going through all of that. We'll spend some time now on newborn home visits. But before we go into the home visiting program, let me just pause to see if there are any questions. And while we're waiting for those who are on the line to ask questions, and you would do that through the control panel using that question feature, wanted to ask, I heard you say something about tri-counties, and I'm not sure if all of our attendees on the line know what that is. Would one of you be willing to explain how you partner with them and who they are?
Yes, so Tri-Counties Regional Center is the government agency that supports families with children who have developmental delays in our county. There's actually, I believe it's state, but each county has its own administrative capacities. And we've been in conversations with Regional Center for many years to talk about how we might partner. And Dr. McEwen and myself and a speech therapist who's been on our board have provided training to the caseworkers for Regional Center on developing a relationship with families as opposed to just going in and fixing something for families, going in and actually being with families. So sort of balancing how you show up and listen and hear and develop a relationship with the family whose children have special needs, and then how you get to the business of supporting specific challenges like occupational therapy or speech therapy. So now we actually have classes at the center specific for families whose children have special needs, and that happens 1 to 2 times a week.
Very good. Thank you for clarifying. And there may be similar programs in other states for those of you who aren't based here in California and have those regional centers is what they're called here. Great, that's helpful. Let's dive into your home visiting program. I'm going to advance to the next slide, which covers self-regulation and sort of development. Feel free to go through this too as you explain how your home visiting program works. And I know you really give us a little bit of insight, but let's dive a little bit deeper.
Okay, this is Renee. So I guess, Joy, I would like to share with you the goals of the program. So the first goal that we have for ParentCare Home Visitation is reducing the isolation for families with newborns. And we aim for early identification, referrals, and resources for both adults and children. So when someone applies for the ParentCare program, they contact me and I will set up a home visit to really get to know the family, get a good sense of what their needs might be, both for the home visitation, but also to bring them into the wraparound services, and also, resources that are outside of the Nan Tolbert Nurturing Center. Another goal is to build family resiliency by supporting a lying-in period, if you will, and normalizing comfort and nurture to new parents in a culture that's a busy culture, and it's a life transition that is not always honored in that way. We nurture a strong community by using the abilities of carefully screened and trained community volunteers. And we make the program accessible to all ranges of income, as we've mentioned, and the use of these volunteers that come forth from the community is one of the ways we help make it affordable. And then finally, the program, as we mentioned, has become professional training. The training program for the volunteers, we've gotten feedback that it's a really powerful training for people in the field. So we've had nurses in training attend the ParentCare training. We've had an occupational therapist. We had a nurse attend. So we're in the process now of really looking at, copywriting and having it ready to share to a wider professional community.
Okay, great. Can you talk to us a little bit about how do you identify who should have a home visit? Is it upon request, or do you recommend it based off of what you're seeing if a mother is in counseling or a consultation service with you? How do you know who to provide home visiting to?
Yeah, well, we feel that all families deserve parent care at the time of the birth of the baby, and ideally, we'd love to meet the family during the pregnancy, so that we can kind of get ahead of things, if you will, and bring them into the services. So it's not just for high-risk families, although we certainly have our share of high-risk families participating in the home visit program. Families are identified through all of the wraparound services. So there's a lot of cross-referral and collaboration between the program facilitators and the program directors. And still, referrals come from outside sources, professionals in the community, people that know about our programming. So we don't discriminate, in other words. Everyone who applies to the program is eligible.
Great. I think that's probably music to everyone's ears that's listening, that every mother deserves a home visit. Talk to us a little bit about, do you have a schedule for home visits? Do you usually go in for a certain number of weeks? And then when does it end? Or, is it dependent on each mother's situation? How does that part work?
ParentCare is a 3-month program, and we really like to serve families in the first 3 months of life of the newborn baby. Having said that, there are times when families do enter at a later stage in the baby's life, when they're identified as being, higher need. So it looks like this. I'll go in and do a home visit, get to know the family, and then I'm looking at my pool of volunteers and kind of looking at what's going on in this family. I look at temperament of the volunteer, the kind of mother she'll be working with. I look at certainly geography, because we have some volunteers that are willing to drive further and some that are staying local to our community. And I'm looking for a good fit. And I will say there's some kind of kismet, Joy, because we've somehow been able to match volunteers with families that just really work out beautifully. So I'll bring the volunteer to the home, introduce the volunteer to the family to make everyone feel more comfortable with a very intimate and unusual relationship. This is not a family member. This is not a friend. Although volunteers and families often become friends through the 3-month period.
Mm-hmm.
And and so and the volunteer is asked to stay within the guidelines and the boundaries of the parent care role. So for example, if we have a volunteer that is a nurse, a retired nurse, or a physical therapist, or a therapist, we ask them that they go in without that hat on, and they just be the volunteer. So what does a volunteer do? We say hands and heart. So maybe it's having a cup of tea, making the mom a cup of tea and listening. Maybe it's holding the baby so mom can take a long shower. Maybe it's playing with an older sibling so mom can have some quiet time with her baby. Maybe it's doing some dishes. Maybe it's going for a walk with the mom. And one of the important parts of the training, and I'm happy to talk more about the training, is a whole segment on how to be with a mom who's going through a big transition in a way that's listening without fixing. It's not a teaching program, and it's not an advice-giving program. It's a, if you will, like sort of like presencing, like just being present, trusting that the family is finding their way. And then I'm checking in with the volunteer regularly because she's the eyes and ears of the organization. She's in the home. So I'm checking in. How's it going? What do you see between the mother and the baby? How's the older sibling doing? What needs are you identifying? How do you feel when you're in the home? The program is set up to have 2 visits per week in the first month and 1 visit per week in the second and third month. And each visit is 2 hours.
Great. That's helpful. Can you tell us a little bit about, and it's great to hear again that these are not clinical visits. These are really just about peers and support, and you hit on isolation, right? That so many mothers have a difficult time feeling isolated, and that this can actually sort of prevent maternal mental health disorders, right? Coming in and having a friend and supporter. Talk to us a little bit about some of the unique things that a program would have to think about when developing a home visiting program like this, and where my head is going is, you talked about background checks, but also you talk to us a little about a training and how do you prepare someone for going in someone's home, and what if they don't feel comfortable? And then is there any sort of risk, sort of legal considerations that people should think about if they want to create a home visiting program like this?
Yeah, and Joy, we're at it now since 2012, and we continue to learn about how to do this as our volunteers present us with different scenarios. We continue to, kind of develop it. I'll start by saying there's a pretty careful vetting process for bringing in volunteers. It starts with a phone call with me. And then if we seem to be on the same page, in other words, this is not a teaching program, this is a program that requires a volunteer to maintain confidentiality about what they are witnessing in the home, other than speaking with me. We have a very small community here, and that sort of escalates that need to keep confidentiality now and forever, for this family to feel safe with the volunteer. If that goes well, they're invited to an informational meeting where I get to meet the volunteer and observe the volunteer in a circle with other prospective volunteers. And I'm looking at a volunteer that can maintain, a volunteer that can be regulated, if you will, have a calmness about them, that can tolerate what we see in a new family. So as you know, in a new family's home, it could be, sort of emotionally chaotic. It can be physically chaotic. We have families that range from, we have families that live in trailers. We have families that live in very expensive homes. So it will really vary what they're walking into. So we're looking for reliability, great communication with me and with their family. We're looking for volunteers that can be very open-minded about lifestyles and parenting styles, that can be non-judgmental. And I ask them to bring their judgments to me, and we'll talk about them, but to really be open-minded about different ways of parenting and living.
That's great.
Yeah. So,
yeah.
So they come to the informational meeting, and we watch, I'm sort of watching how they are. And also people that can sort of, the phrase, when in Rome, do as the Romans do. It's sort of, can they enter a home without sort of overtaking and without being too sort of down-regulated, or they're too shy, right? So it's a special kind of person that gets invited to the training. So after the informational meeting, if it feels like a mutual fit, then they're invited to complete a background check consent form and a reference check. And after that, then they're invited to training.
Very good. Very good. That's helpful to hear how the vetting process works, and also to hear that you're really their support if they have something they need to talk about what they have seen or need to process with you versus the parents and judging parents and families. So very helpful.
And Joy, if I may add, there's group supervision for the volunteers, 2 group supervisions they attend, and there's 2 phone check-ins, but with me, but also phone check-in as needed. We really feel that volunteer support is really crucial to the success of the program.
Very good. That makes sense. I'm going to pause and see what questions are coming in. We do have one that's come in. Let me read that now from Juliet. Juliet wants to know, how do you work with families with Preemies or Nicu Babies, and do you start working with them even before they come home from the hospital?
Well, we would be happy to work with them whenever they're sent our way. However, usually we don't meet them while baby is still in the hospital. But this is an example of the wraparound care and how important it is. So I may be called in for parent care, and certainly a family with a preemie is likely a family that may need psychotherapy, counseling. It's a family that will need maybe support from the special needs part of our organization. And peer support is vital to a family like that. Breastfeeding.
That's helpful.
Yeah. And referral for pumping. A lot of these mothers are struggling with pumping milk, and breastfeeding support as well. As well as they probably have been referred to Tri-Counties Regional for all the supports Carol referenced, but making sure they're well connected there.
Great. I want to touch on 2 more things before we conclude today. One is evaluation of your program, and the other is funding and how many FTEs per woman, right, or expected birth rate. All of those types of things I think are helpful for people who are wanting to consider doing a home visiting program in their communities. Can you start with the evaluation of the program? This is a cornerstone, I think, of why your program won the top, not just the honorable mention in the honorable mention category, but you won in the care category because of the results that you're seeing around impact. Can you talk a little bit about the evaluation and the results?
Sure. Well, the first thing I'll say about that is every family that participates in ParentCare has a phone exit interview, and it's a pretty extensive interview where we get feedback on the program, we get feedback on the volunteer, and the feedback is also shared with the volunteer. So that volunteers can really feel part of it and not just sort of like it's over and, they get to hear. There's an intake survey for all our families, typically the mother, and there's an exit survey typically for the mothers. And I think Carol can speak more to some of the other questions you have about data.
Hi, this is Carol. So data for all of our programs, we are, there's data to sort of check, like, are we on the right track? Are we supporting parents in the way that helps them feel more empowered and more connected to their children? There's data on income and ethnicity. There's data for grant purposes. And one of the things that, we've been trying to develop is that qualitative data. What are we asking of families? How do we measure when a parent enters, for example, and there is tension or a nervous system reflecting a new baby, which can be wobbly. And then how do we measure that a year down the road where we see a parent is settled and parent and baby are actually finding each other in a way that resembles a partnership without undue stress. And I would have to say that we're still working on that. The best assessments are sometimes just written assessments by people. When we ask them, how was this experience, or what other comments do you have? That seems to, the testimonial in some way is much stronger than the, tell us if you strongly disagree or if you strongly agree. It's hard for us. I would love input from some of your listeners if they have ideas on how to measure attachment and calming and regulating and joy, particularly during those first 12 months. Is that helpful?
Yeah, thank you for that. And it does just seem, the founder of Postpartum Support International, Jane Honigman, who I know is in your backyard, uses that word, or at least this is what I recall, right? It's all about distress. And if we can reduce distress, then we can improve all of those things. And it just obviously feels so intuitive even to us that if you can measure sort of reduction of distress and improvement of confidence, that all those things will fall into play. And I am looking in the question box now. If anyone does have any additional questions or thoughts on that measurement piece, feel free to share them using that question feature. And then let's wrap up. We've got 2 minutes left, and just hear a little bit more about the resources in terms of FTE, full-time equivalents and volunteers, and how do you know how many people you need to run a program like this? And then how have you sustained it? I think you've really hit on, the volunteer component of it. And Renee, it sounds like you are primarily over that volunteer program. How do you, is it really income received through your psychotherapy programs, or is it continued grant funding that funds your position to oversee the volunteers? Anything you can add there?
Yeah, so this is Carol still. Funding is our biggest challenge, and then sustainability is right behind that. It's not easy to provide a program that turns no family away and that does depth work for families. So we really, sometimes you hear about like cradle to career services for family engagement. We're really cradle to school. So it's long-term relationships that we're developing, and so we're always working on getting new donors, because what our experience is that we're less likely to get government funding than family foundation money or individual donor money. We charge for services, which brings in some income, but then we have that sliding scale. One of the things Dr. McEwen and Renee and myself are looking at is just sustainability theoretically and philosophically. What happens to our programs if Renee is no longer a parent care director, or Dr. McEwen is no longer a clinical director, or I'm no longer the director? How do we sustain what we're doing? And the way that we're doing that is trying to write everything down that we're doing, which includes pieces on observation, on co-regulation, on temperament, on play, on infant-parent attachment or infant caregiver attachment. So we're just trying to document all our work so that piece of sustainability theoretically and sustainability financially is tricky. Yeah.
That's helpful. And I know I've asked you this before, Renee, and we'll take time just to make sure others don't have any final questions. But this issue around sustainability and covering services, I don't think that you've considered billing insurance. But do you mind commenting on that? Is that something that you would reconsider in the future? And I know that would be difficult if you're not providing clinical services in home, right? Because you can only bill for clinical services. But anything you guys want to add on that, insurance billing piece as to why you haven't done it, or why you might consider doing it even for your psychotherapy services?
Yeah, so this is Carol again, and Renee and Dr. McEwen are both sort of shaking their heads no. It's been very complicated for us to move towards insurance. One, because somebody needs to administer the bureaucracy of managing insurance, and two, because we're not a clinic. And so I think that that's in our future. And I think the center would invite helpers to make that happen. Marcia, Dr. McEwen is our clinical director. Renee's our parent care director. I'm the past director. Out of the three of us, I would say that our skill set is really direct services to families and to interns, not necessarily running a business. So and I have to say, having a strong board has really been important to us too. It's incredibly valuable, and we count on the board to fill in the gaps for what is out of our expertise.
Great. Well, and it's good to be realistic about what services and what practices and skill sets you have, and go deep where you do have those skill sets. Great. We do have one last question that we'll take before we conclude today's webinar. The question is for Renee, and it says, Renee, what specific strategies do you believe foster the hands and heart, in quotes, approach to home visitors, and what they need to learn about that approach? So any specific strategies you think foster doing that well, and not,
Yeah. I think that really points us to the training, Joy. It's a 6.5-hour full-day training, and the content involves refreshing and understanding the wide range of the postpartum experience for moms and for dads. We cover attachment attachment theory, why it matters, attunement, regulation, narration, being with babies with respect, bringing calm, and how co-regulation works, not only for mother and baby, but for volunteer and mother, and for me with my volunteers, and then for my upline and me. So we like to think of it as, you throw a pebble into a pond and you see those rings of circles. And in the very center is the caregiver and the baby, and then we're all sort of co-regulating. So, it's kind of like when the baby cries on the airplane and everyone wants to help. We're meant to get upregulated by babies that cry and have needs. And then when the baby calms, everyone takes that deep breath. So this is what we're always doing together, like, the up-leveling, the upregulation, and then the calming. We do a lot on listening and how to refrain from advice giving. We have a lot of laughs in the training because we're such a fix-it culture, and we're constantly learning how hard it is to not give advice. The training involves a lot of self-reflection, learning to observe ourselves, and also we focus on self-care in the training. We focus on understanding the boundaries of parent care. Where are the gray areas? How easy it is to get outside of the scope of parent care. And in the training, we use, both sort of, interactive. We have videos, we have music, role playing, and we just have a really good time. The volunteers tell us that the training really prepares them to go out with a family and feel confident. And of course, they know that I'm right at the other end of the phone.
Great. Well, thank you so much for that overview. I think that did answer the question that came in. And we want to thank those of you who had attended the webinar live with us today and remind you that you can find some additional information, including the application that was submitted for this program that the independent judging panel, who's quite esteemed, selected this program from. So take a look at their application. There's some great supporting documentation in that application as well. We also have Renee's email address up here on the last slide that they've shared, so feel free to email either of us. You saw my email, joy@2020mom.org. And Renee, did you want to add something?
No, we're thankful to be part of this today, Joy. Thank you so much.
Thank you, and congratulations again on being the winner of the Innovation Awards Program in Care for Maternal Mental Health. We appreciate it, and take care, everyone. There will be additional webinars in this series with additional winners, so feel free to check out that Innovation Awards website on the web page on the 2020 Mom website for more information. Thanks, everybody, and enjoy the rest of your day.